afternoon, everyone. This is Dr. Perry again, and we got another lively broadcast. I'm really happy today. I have a really special guest talking about from graduation to your first job. And Dr. Patrick Assioun here is a very good friend, and he's has a lot of information he's going to share with us today. And one of the today is really important is how you're going to transition from being in dental school to your first job. And you got a lot of questions that you really don't know what you don't know. But today you're going to know almost everything, not everything, because we got to have other podcasts going on. But we're going to go over a couple of things about contracts. We're going to go about what you should be looking for in an employer, as far as mentorship and all the other things that go along there. So I want to just tell you a little bit about Dr. Assioun because he's the founder of Passion Dental. He has a few offices around the state of Massachusetts and New Hampshire and Connecticut. He's got extensive experience in hiring and firing and looking at people and monitoring dentists and making them better than what they are. And he's going to help us understand what the job market is today and what's going on and let you know what is what. So, Dr. Assioun, thank you for coming on board. I appreciate it.
Thanks for having me here.
And I know there's a lot of people out here that have a lot of questions. So I want to know, I'm a new graduate and I'm looking for a position in a DSO. What do I need to know? How should I look for a job? And what perspective should I take?
Well, first of all, thanks a lot for having me over here. And it's a great time to be a dental graduate, to be in the field of dentistry. And I would say that it's as much an interview for the candidate that it is for the employer as well. So I think that the candidates need to be aware of what's out there,
right,
and they need to be picky,
right, because
it's as important for them to know what are the options out there. And so I would, focus the desire on where do they want to live, on whether that group has a clinical development, mentorship, collaboration,
right,
investment. Is the group or is that practice owner going to be investing into the development and education of that candidate, particularly if in the first 3 to 5 years. That's very, very important to focus on that development piece.
So you got to get on board. I mean, so would you say that all DSOs are not the same, or are they all the same?
They're not all the same.
And what makes it different? What should they be looking for? Is it, how do I know it's a good fit for me, or
yes,
what can I do?
Well, I think that there has to be a combination of things. Number one is we'll talk about the compensation, but before we talk about the compensation, I'd rather talk about the mentorship and the clinical support. So the first thing that that a candidate should evaluate is there collaboration, is there mentorship, and what type of clinical development do they have investing into those candidates. For example, at Passion, but I'm just going to cite Passion because I know what we're doing, and other groups, there are other groups that are also great, and they're also investing into their candidates, into their young graduates, because the school is doing wonderful, but the field of dentistry is evolving at such a speed that the development needs to keep going. And we have a great program here at Tufts, and to that it's a great foundation, we need to keep building. So for example, to ask, is there a mentor in the office? Can they discuss cases that might be a little bit more complicated, right? Okay. Do they have courses on implants?
Right.
Not restoring implants, but also placing implants after having restored such, at least a minimum number.
So when you say there's a mentor, I mean, this is someone that's physically in the office, hopefully with you, that can guide you.
Yeah.
And so if you're getting trouble, like say you're doing a difficult extraction, you may not feel confident about something, you might have someone that's there to help lend a hand for you, or how?
Great question. So in our organization, we have multi-specialty offices. So if you're a dentist and you want to schedule an extraction, you can schedule it on a day that we have an oral surgeon in the office. It could be in your column, but if you need any help, the oral surgeon can come in and help you out basically on your extraction. So that's available. We have a chief clinical officer who's wonderful. So that's also an addition that a group can have. So we have this at Passion. But also the collaboration has to come from some of the dentists at the office level, right, other colleagues, other more senior dentists. that are well versed in either root canals or in dentures or implant supported dentures or in crown and bridge, etc., etc. So the key is to have some collegiality, collaboration at the practice level, but also in addition to that, we have, in our case, Chief Clinical Officer. Her name is Dr. Weber. She's wonderful. And so that's an added benefit as well.
So they'll help guide you. So help develop your expertise.
Totally.
Instead of running, coming out of the gate, you're kind of walking. Not knowing, and then, so you don't get in trouble.
Absolutely. So at Passion Dental, one of the things that we've had is we're attacking it from 3 different levels. We have a dentist. Her name is Rebecca Meisner. She's going to be coming in and she's going to be helping the dentists that are interested in children dentistry. Okay? That's one aspect. Then you have Dr. Raber, who's coming in. Anyone that's interested in adult dentistry, she can help develop those skills along with existing mentors at the practice level that we have. And on top of that, we have different programs going with Nobel. As a matter of fact, I think that one of their speakers is a teacher here at Tufts that's going to be working hand in hand with our Nobel, our Nobel course that we've implemented for that. So
people that want to get into implants, they can.
Exactly. As a matter of fact, one of your students, Anthony Dame, has registered this year. We have 20 people that have subscribed to this program. And on top of that, we have the Spear Institute. I'm a big fan of Dr. Frank Spear. I've taken a lot of his classes.
Excellent.
As you and I know, dentistry is an ever evolving.
It doesn't stop at dental school.
It does not stop at dental school. So you got the good foundation, you got the good thought process, and this is really, really important. And with your leadership and the leadership of Dr. Dean Karenbachs, and all the teachers that you guys have here, it's amazing. But on top of that, we got to keep building. And so joining a DSO that has or private practice that have all those elements, that's what I would put as of a prime importance.
All right, I got to ask this question because I know my viewers are going to be asking this.
Okay.
They want to know, show me the money.
Sure.
And it shouldn't be the first question that comes out of someone's mouth.
It's one of many.
It's one of many, but it's an important aspect.
Absolutely.
People who have gone through dental school, they have loans, they have to pay back things, they have families, they have to, they have to live.
Absolutely.
But what, I see a lot of DSOs that come on and say, hey, I can make 200,000, I can make 250, I can do all this. But is that all I should be looking at? Is just that number, or should I be what else should I be looking at in getting that number? In other words, like CE, malpractice insurance. Am I on call 24/7? Do I have an assistant? Do I have growth?
Yeah, and
ownership.
And ownership. Great. A lot of great points here, Dr. Perry. A lot of great points. Most DSO cover malpractice. They cover the CEs up to a limit, and so we have up to $3,000. But we've implemented a clear aligner program. That is, the value of that is over $15,000. We have that for every single candidate. It's actually based on as an orthodontist, I've set up my own clinical preferences on that. So we help develop the candidate in many different segments.
These are clear aligners.
These are clear aligners.
Like Invisalign.
Exactly, Invisalign or clear.
Just want to keep everybody on the same page.
Correct. If you're interested in clear aligners, we have it. And
so you can get trained in that.
You can get trained on that, and we have a course that costs just under $15,000 on a yearly basis, and we have this at Passion Dental.
Right, and you mentor them, and you overlook it too, right?
I mentored along with Luciana Arcar, who helped set those cases up for me. Absolutely, okay. And we have ongoing discussions with the dentist, and so we help them see how we develop the ClinCheck, and then when they treat their patients, they're going to be able to see. And see the progression of all those cases, and we also use dental monitoring with clear aligners, so that the patient is following the progress by using that scanning device, and it's it's done weekly, so it's tremendous because the doctor is also learning how the tooth movement in terms of what sequence of tooth movement, what type of tooth movement has to be done first. So we're doing that for them. So it's really great.
So if you have some clinicians that may, hey, look, I'm more interested in seeing pediatrics,
right?
Or I'm more interested in doing root canals. Yep. They can get trained or help with CE getting trained.
Absolutely. As a matter of fact, Ali Nasser from the Harvard School of Dental Medicine has given here on this floor a course in, I think it was in December, and he's giving it again in June, and about half of his the class was members from Passion and Dental. Yes. So, and he's giving it away. He's giving it again in June. He's a very close friend of mine and colleague of mine, and so whatever the best DSOs are, the DSOs are going to be investing into the different type of categories and where you want to develop your skills, whether it's children dentistry or adult dentistry, crown and bridge, more root canals, more implants,
Right.
and so at Passion we're investing millions of dollars in the development of our doctors, because we feel that this is a very important thing. But you've asked about compensation.
Yeah.
And compensation is not the only thing, but we talked a lot about the development and the mentorship. So let's talk about compensation now.
Yeah, let's talk.
Right?
Let's talk.
'Cause
Show me the money.
Show me the money. So this is important. I want to make sure that I don't forget about that. Initially, there'll be a period of time where the candidate or the young dentist will have a fixed daily rate.
Okay.
Typically, most DSOs go for 3 months, 6 months. We have it
When you say 3, 6 months, this is like a guarantee.
a
No matter
guaranteed
what.
daily rate. So let's put a number to that.
Let's put
Let's
a
say $750 a day.
Okay.
And so that would be
Guaranteed.
guaranteed.
As long as they
Guaranteed.
show up and they're
As long as
breathing.
they show up, they do that.
Okay.
Now, and in some group it stops after a certain
Yeah.
period of time, whether it's 3 months or 6 months, and in other group it does not stop, such as Passion.
Oh, so it keeps going.
It keeps going, but because and we always reconcile it to your at Passion we reconcile at the adjusted production.
So if I make more than what I'm actually
Exactly.
taking, and that's $750 per day,
Yes.
in a quarter,
Yes.
then I would get the extra.
Right.
But
exactly.
if I go below it,
then we don't.
we don't say, okay, you owe me
That's
the
right.
money back. But
That's
some
right.
people do, right? Some DSOs
Some people do when it's a draw. So let's go over that example because I think it's important for the audience to understand
Yeah,
that.
of course.
So if you're making $750 a day, 5 days a week,
Yeah.
on a quarterly basis, your guaranteed salary would have been $45,000. If you have
In 3 months.
in 3 months, at the 3 months period,
Okay.
if you have, let's say, produced or collected $100,000, 35% of that, which is the norm in New England here, it's about 35%. On the West Coast, a little bit less, okay? But over here, you know,
So just to put the number,
35%.
that's about $180,000 a year we're talking.
That's
Without going above and beyond.
That is, yeah, without going above
And
and
that's
beyond.
not counting the other items that
all
they
the
would
other
get,
stuff. That's
like
just base salary.
the CE and everything else.
That's right.
And the malpractice.
And the malpractice and the dues and all that stuff, right? So all of that is extra,
Right.
and the benefits and the PTO and all
Right.
the other jazz. And so, if let's say the dentist made $100,000, 35% of that is $35,000. In this case, he or she got paid $45,000. There won't be any bonus. But let's say that
So in a quarter, just so we put numbers into it.
yeah,
If they're getting 35% of their production and they produced $100,000, that means they would only make $35,000 for
But
that
they got
quarter.
paid.
But they got paid $45,000.
in this
and they're
case, they're not owed any bonus.
fine. Right.
But let's say they did double that. Let's say, just for example,
yeah.
so 35% of 200,000 is $70,000. They got paid $45,000.
Right.
So the delta would be that they would get a bonus of $25,000.
Gotcha.
That makes sense.
Makes a lot of sense.
And this dentist, I would make them partner in no time, provided that they're aligning with the culture. So what's very, very important also, it's not only about production.
Right.
So the DSO or the group, it's very important to survey the patient, right? You got to survey the patient. You got to make sure that that patient had a good experience, because at Passion Dental, one of the key things is, and I'm sure it's the same in many other DSOs, is the patient experience. So for us, it counts tremendously. And so we survey the patient every time they come. Every time they come, it's like, just like Uber, basically.
Right.
Every time, how was your visit, right?
Right.
Give us a star, give us a number of stars and all that. And so that's very, very important. In this particular case, the dentist would get a bonus of $25,000. Now, what I want to talk about is the draw. Some groups or some private practices, what they will say, here's $750 a day, but at the end of 3 months or 6 months, this is a draw, and at the end of that, we're going to do reconciliation.
Right.
So in this same example that we took as an example, the percentage was 35,000. The candidate was paid, or the dentist was paid 45,000. So there's negative 10,000. So then they'll keep that. They'll keep that negative, and they will
take it from the next draw.
From the next draw when they go on production. Does that make sense?
Yes.
They'll take a percentage of that. Now, most progressive group have gone away with that. What they'll say after 3 or 6 months, if it's positive, we owe you the bonus, which is great. If it's negative, we're going to move on from that. We're not going to take that against you. We'll just move on percentages.
But you should understand your contract.
You should understand the contract. That's very, very important. And with that, your sub-question is, or was, do I have a chance to become an owner or become a partner in that? And absolutely. And in our situation, we had a fantastic dentist. His name is Dr. Farah. And after 6 to 8 months, he did tremendously well. And we made him a profit share partner. And now he's on to his second location. And we give them profit share if they're very good in their areas where it's tough to get a dentist. They're fully aligned. That's something that we can look, or we can have an ownership plan for you. And the key is to make it very easy for the doctor and the talent to become an owner, because now not only they're getting paid as a doctor compensation from a doctor compensation, they're getting a piece of the pie as a distribution.
Right.
So that's that.
So it sounds great. I mean, obviously the candidate should be looking for the right DSO, and you're obviously looking for the right candidates to fit into your culture, because it's not always a fit. It's the same thing I do in my own program. I do the same thing. But now, let me ask you this question, because a lot of candidates think, well, why do I have to work for you? I mean, I could get on my own. But you talked a little bit about the balanced life, and what's going on, because you might want to own a practice, but the dentistry, as we all know, as you get along and as you progress into it, the dentistry is not really the most difficult part. It's actually managing the business.
Yes.
So I may be a young dentist, and I said, geez, I really want to balance my life. I mean, I don't want to work 7 days a week. I want to have someone that can control, help me understand in hiring and firing. I'm not really good at that. I'm better with the patients. Are there pros and cons to this, or?
Absolutely. I think that initially, in that initial phase, Ron, the key thing is to learn. And so anybody's going to make mistakes. And as good as I thought I was, I still went and got a job because I wanted to learn initially not only
the ins and outs,
to be mentored, but the ins and outs, the practice management, the risk management, the HR. And as an owner, you're the last one that gets paid. Right. So graduating out of dental school, which is tremendously expensive nowadays, right? You graduate, you have a debt, and then you're going to set everything up, and you'll be the last one to be paid. I think it is a wise idea to work for someone, with someone, and I would say with, not for, because when a dentist work with Passion Dental, they're working with us, not for us, because we want that to be a symbiotic relationship, and we want them to be happy, because we are investing so much, and that's true for any group. They're going to be investing so much in you that what you want to do is learn as much clinically, development-wise, and learn the business. And so the other thing that we teach, as a matter of fact, is the P&L, the performance of your practice. You will get visibility on your clerical talent expenses, on your clinical talent expenses, on the rent, on the supplies, and so you'll learn the business. And this is really important. And if you want to join a group or private practice or DSO, you got to make sure that they're exposing you to all these, so that at any given time, whether you become a partner in this DSO, in the DSO that you're working for, or you want to branch out and own your own, we want to make sure that you have transparency and an open book management, so that you can be the best version of yourself as a clinician and as a business owner. And if you are talented and you have that tiger mentality, and you're not a diva, if an assistant calls out, you're going to roll your sleeves up, and you gotta bring the staff up. The common denominator is not how good you are, but how good you can get you and your staff to be, because you
working
are
as a team.
Working as a team. Right. And when I see this, we make it very attractive for the candidate to become a partner or profit share partner, because this is very attractive to the group, and so your talent will be recognized and discovered wherever you go.
Right.
Be hungry, put dentistry first,
Right.
put quality first. Speed will come. The speed will come with time, with repetition. You want to make sure that you have the right technique. So I like teaching tennis. When I teach tennis to my daughter, I want to make sure that we have the right technique, and we're just not drilling to drill. You know, drilling, not teeth drilling, tennis drills.
You gotta walk before you run.
That's right. So that's very, very important.
So what I'm gathering from you is that the first few years in graduation, it's really important to understand not only the dentistry itself, but the business of dentistry.
That's right.
So is it safe to say, I don't want to put any words in your mouth, but would it be safe to say no matter what, you should work for somebody to understand, whether it's you or some other DSO?
Open book.
Right, and understand what's going on before
Absolutely.
So if I was a young dentist and I say, Dr. Assioun, I really want to own my own practice, would you recommend someone coming straight out to?
Not yet. I would say you're going to make a lot of mistakes, and those mistakes are going to be on your account. They're going to be expensive. You're better off working for somebody, because then after let's say 3 or 5 years, when you open your own practice, your takeoff is going to be at a much steeper angle than trying to hodgepodge, yourself as an owner, and learning the HR, learning how to talk to staff, learning how to lead staff, and all that. I think it's good to join a group that has done that, so you know what the recipe is, and you go back. And I'll give you an example. Dr. Shalef Sabari, an orthodontist with me, that worked with me for 7 years at Family Ortho, and he worked with me for about 7 years. Then he went up to Toronto and opened up his practice. I'll tell you one thing: I would not like to be his competition, because I taught him everything I could. You know what I mean?
Right,
and so he went on his own, and he has a thriving practice now.
That's great.
And I know for a fact that had he gone on his own, he would have been trying to put the pieces.
He would have figured it out, but it would have taken a long time.
Take a long time, and making very expensive mistakes.
Yeah, and it's very wise advice, and I hope our listeners are listening to what you're saying, because it really is important to understand what you don't know, and
you don't know what you don't know.
Right, you don't know what you don't know, exactly, and you got to also see what works, and what works for you, and you see what's happening out there, and maybe develop your own style. On how you treatment plan, how you talk with staff members, how you talk with patients, and all the other things. So let's change subjects a little bit about this now. I'm a young dentist. I see dentistry's changing. It's changing very rapidly, as you said. Yeah. We've got a lot of AI now. Does your organization, are they involved in like Overjet and things of that nature? Do you have that? Do you have all the new technology? Do you have the CEREC scanners? Do you have scanning machines? Or I want to do the same day crowns and all that other stuff. Do you have all that?
So we have Overjet.
Okay.
So one thing that we have today that we didn't have when I graduated is all these tools, right? And right now, patients want confirmation for your diagnosis and treatment planning, and so when you have Overjet that shows you, it's still up to you to determine what is it that you want to do with those clinical findings, but it points out with those arrows your bone level, your radiolucencies, your open margins, and all that. You're objectifying your clinical findings, and this becomes a very, very, very important step in the evolution of dentistry to get case acceptance, because
and
now
build up your confidence, right?
Yeah, it's going to help build your confidence, and not only that, it's going to instill trust, which is very important, trust in your relationship with the patient in case acceptance. So we use Overjet. We use also dental monitoring.
Right. And
dental monitoring is coming up with a new product that I'm not at liberty to say, but we're very, very proud to say that we're using dental monitoring when it comes to clear aligners and orthodontics.
That's good.
And Overjet as well. And we're also using AI in different departments, such as, and that's something that you learn, such as the voice, the phones.
Yep.
The phone, so
we
would need to otherwise hire 2 or 3 analysts to do that. In this particular example, you have AI that is triaging the phones, any missed calls, any phone calls that got made. It will also judge, as a matter of fact, the sentiment of how the person on the phone took the call, and every agent or every person that takes call, like for example, if you took 10 calls and I took 10 calls, it will grade your 10 calls and my 10 calls, and it will say, it will grade us. So now you don't have any person, any human, trying to teach. It's it's an AI tool that's grading objectively the person. So we use that, and we're using AI also in our phone technology, so to speak.
But it's not replacing you as the doctor. You're making the final decision.
Yeah, you're making. So it's enhancing.
adjunct.
Yeah, it's enhancing. It will enhance your delivery of your diagnosis treatment planning. There's nothing more important than that. All those tools and gadgets, and they're nice to enhance your diagnosis and treatment planning skills. At the end of the day, you're the one that are going to tell the patient why they need what they need, and what will happen if they don't do anything. Which is one of the key things that I learned from Frank Spear himself. Is that when you diagnose and treatment plan, this is what I see. This is what will happen if we don't do anything. And take a pause. Let the patient ask you.
And get them involved in the treatment plan.
Exactly. Doc, what do you think we should do? We can do this or that. Always give two options, not more than two options, and recommend one of those two.
So, you as an organization and me as a dentist,
yes,
and I'm using these tools as an adjunct, and it's helping me build my self-confidence and say, geez, I don't have my instructors right next to me. I can't go say, hey, I think there's decay here, or I don't think there's decay. We can kind of know, hey, the AI might be steering me in that direction and say, okay, hey, you might want to take a look at this area. So now we can kind of get an organization and an individual, pretty much everybody on the same page, and say, yeah, we all know that there's decay there. So the only difference now comes down to, as an individual, we can treat it with an amalgam, we can treat it with a composite, we need a crown on it, or whatever the treatment plan may be.
And whatever the clinical culture is, because sometimes if your cavity is showing on the x-ray that you're within a millimeter or a millimeter and a half, chances are the pulp may get exposed by the time you debride that cavity. So it's all on the delivery. I see a big decay on this tooth. We're gonna go ahead and debride it. We may need a root canal. Once I debride it, we're gonna let the circumstances dictate the situation and let you know. Although you're gonna be numb, you're gonna be awake and aware, and I'm gonna let you know. And so the communication, I cannot stress the importance, and I know you do a great job at teaching your dentist, at your student dentist, about how to communicate and improve that, because this is the single most important element. Your delivery of how you carry yourself and how you speak to that patient, and public speaking is something that I know you have some. You recommend that your students take classes and all that. I think that your communication skill is one of the best investment that you can do on yourself, because we know that you have the skills, we know that you have the thought process. Now your key is for you to be able to connect with your patient and not overwhelm them, and make them feel at ease, and make them feel that they trust you, because at the end of the day, you are the healthcare provider when it comes to oral health. Oral health is part of systemic health as far as I'm concerned.
Exactly.
And there's nothing that's as important as any other aspect of systemic health.
No, I think these are all great points. So what I'm gathering from you is that you're helping these young dentists, you're mentoring them, you're using all the new technologies, you're helping them if they want to be a partner or become part of the organization. If they make the right fit, they can be, and that's great. So with all that said, with all this great stuff that's going on, I mean, I know there are some other DSOs that have similarities. I mean, they're all not the same, but they have similarities. So I'm a young dentist. I come out. What do you usually expect? What should I, as a young dentist coming out, what would I expect to, like, in my first year of practice? I'm fairly confident. I'm in the middle of my class. I'm not the star. I'm not the bottom of the list. What could I expect to produce? Because it always comes down to the money. They always want to know about the money. They want to know, am I going to make enough?
Well, you're gonna have a daily rate, right? So that's going to be.
So you're going to get guaranteed. So you're going to make $180,000 no matter what.
No matter what. Now, the key is that the DSO would want to see a progression in your ADP. ADP stands for the average daily production. And so as long as you're improving, that's amazing. That's what we want. We want you to keep improving. And obviously,
at your pace.
At your pace.
Right.
We want you to, you're running on the treadmill. we will not set the speed of the treadmill because we don't want you falling.
But there are some organizations that do set that speed, right?
When they have, so sometimes they do, and that's because they have a director owner. We don't have that, which brings another point, which actually is a triaging of the patient. So we at Passion Dental do not triage the patient. You get your fair share of patient. In some, I'd say that sometimes the owner operators or some other groups where you have a doctor owner, they keep the big cases to themselves,
Right.
and they're just giving the fillings or something to
Right.
the associate. So one of the important aspect to or question to ask is that how does the triaging of patient happens, right?
Right.
And so is that fair? Is it does everyone get their fair share? And then
Right.
if they can't do one particular case and they can discuss it with the senior dentist. In any given office, we have 1, 2, or sometimes 3 dentists that are working, a traveling orthodontist, a traveling oral surgeon.
Right.
So there's a lot of collaboration, lot of that. So to go back to your basic questions, that you have your daily rate. We don't want you to. We want you to learn slowly, as long as you're improving
Progressing.
and progressing. That's fine. I think that in the first year, anywhere between $2,000 and $3,000
Right.
of your ADP, that's great.
Right.
Actually, your student is doing better than that. Some of
Right.
your students, whether Islam and Brockton or
Right.
Anthony, are doing better than that. So yes, I mean, you have you can be proud of your student dentist.
I'm glad they're listening.
Yeah.
You know?
And we're coaching them and showing
Yep.
them and pairing them with good mentors, and they're listening.
So what I'm gathering from you is that you made the very distinct point about the triage.
Yeah.
So you got to find out how you're getting new patients. So if a patient asks for you, they ask for me in the office, I would get that patient. If it's coming down to in succession, there's 3 doctors in there. They're not asking for any particular doctor. It would just go 1, 2, 3.
Not only that, forget it. That one way is to ask. Another one is, oh hi, the patient is calling, I need a crown.
Right.
And so your front desk already know that they need a crown, and what you want to do is that they're booking that patient the first available, not
Right.
necessarily a crown because Dr. Perry is a senior doctor,
Right.
and I'm going to give the junior doctor
Right.
more of the less important procedure or less productive procedure, because at the end, let's face it, that's happening, and so
Right.
you got to make sure that the triaging, the
But-
triaging is fair.
But also you've got to have some oversight on that, and that's where your dental directors would come involved. So in other words, say a big complicated case, and I mean the young dentist has to know their limitations. They may not be ready to do implants right away. Or they may not be able. May not feel comfortable doing a 5-unit bridge or something, or full mouth
So
reconstruction.
they can do it right. So they can do it in conjunction with that dentist
Okay.
and the oral surgeon. Does
To
that
learn.
make sense? To learn. So they'll do it in conjunction. So we have that program. Also, we give that hybrid thing. So the dentist
But
in this case.
not all offices are like that.
Well, we did that because I'm a clinician and I knew, and I know sometimes those candidates that are coming from, let's say, another group. Why are they coming, and what is the thing that disappointed them?
Right.
And some of it was the triaging. And so we make sure that while the triaging is not happening, we also want to make sure that the person, as you said, is comfortable doing a particular procedure.
Right.
And therefore, when
Because
they're
it's about
not,
the patient.
it's about the patient. And so when they're not, what we want to do is that, unless it's a case that they don't want to deal with it, sometimes you have dogs that don't want to deal with root canals, so they'll refer to someone, either a traveling endodontist or another clinician that likes doing root canals.
Mhm.
And that's also the case for removal dentures. Sometimes you have some of the dogs that don't want to deal with removal dentures, and others that are known. And so in some of our offices, we have 2 or 3 dogs. One that likes doing endo, the other one that likes doing removal dentures or implant supported prosthesis.
Right.
And so it's really
So
you
you
start
can do
developing
what
your
you
own
want
niche. You
if
can do
you-
what, yeah. But we're not going to let your lack of skill in a particular area that you want to expand stop you, because you can collaborate with people that can under that roof.
Which is great. So you kind of like you get the bicycle wheels on there, the
That's
training
right.
wheels to help
That's
you.
right.
And
That's
so
right.
you don't fail.
So
and the
yours,
patients-
so your student, for example, in Brockton, was helped a lot by Dr. Paul,
That's great.
and now he's doing fantastic.
That's great. That's great. So let's we just got a couple more things I just want to go over because there's so much information. I mean, you unraveled a lot of stuff here for our audience here. Let's talk about the contract. I come out. I'm seeing an employer, different DSOs, and I know that some of them get pressured right away. Say, well, I'm giving you an offer today. You got to sign right now. What advice would you give about a contract, and give me some key points that they should look at?
Great question. I think that a very short deadline is a red flag. I think that it's good to have a deadline because we're, for example, we're interviewing, and so we want to make sure that that person that we interviewed that's high on our list, we want to help them make a decision. We want to help that candidate make a decision. So is there something in a contract that they want to know more information on? And so I obviously recommend that every candidate get, an attorney looking at the contract, because I think that's important.
Do you say get the attorney right away, or how?
No, look at the business terms first. Look at the business. Are you happy with, so going from the outside in, as provided that the culture is there, there's good clinical development, all of that stuff. Then you zero down to the contract and you look.
So
at
you
the
you'd advise them to visit an office first.
Of course, you got to see. I always say, go and watch the dance floor in action. You only know how good a nightclub is if you go during nightclub hours, right?
Right.
So you got to go to that office, right? When they're in action.
Right.
Go and visit it. Talk to the dentist. Talk to the staff. Feel the pulse.
Right.
Feel the vibe. It's like walking into a restaurant.
Would you want to be a patient there?
Would you want to be a patient, or you feel that the environment is welcoming and all that stuff? Because that's where you're going to be working, right? So you don't want to go. You can visit an office on a Saturday or Sunday, but the key is to see it in action, right? That's a key point. Now, once you see it in action, you spoke to some of the docs, you looked at their clinical development, their mentorship, their CE, all of that, the PTO, the benefit package and all that. Now that you're happy with it, you have a contract in your email, right? And you start looking at the business terms. Is it collection or is it production? I'm rooting for you guys. Look out for adjusted production, because there's nothing more important than having a hungry dentist look at their production at the end of the day, and you want to know what that production is. And I want to make a distinction between adjusted production versus gross production. So gross production is, let's say you have a filling for $450, but the contracted rate for a 3-surface filling, let's say $300, not $450. So the collectible production, also called adjusted production, is $300 in this case, and not $450, right? So adjusted production, which is the production you are looking at. So
you make 35% of the 300
of that adjusted production. The employer may want to go for collection. I would try to negotiate adjusted production. We have at Passion adjusted production because I want the candidates to know what they're producing at the end of the day. I want them to be hungry and closer to the pulse and the cadence of what you're doing on a daily basis, right? And if there's an adjustment that needs to be paid, you want to be able to have access to that biller that's doing the adjustment so that you understand why we're doing that adjustment, so on and so forth. So adjusted production, I'd favor that for you guys over collection, okay? That's number one. Typically 35% is,
And you give them access to the reports, right?
Open book, I want them to, of course. I want it. Someone who is not, because there's no one
that cares about
that
your money.
knows, not only that cares, there's no one that knows what they produced more than you did. So at the end of the day, you get your production report and you look at the schedule and you check, you make sure that it is what the production shows. Let's say you were planning on debriding a cavity and it was a 3-surface filling, but you ended up doing
a root canal.
A root canal, right? And a root canal and a porcelain core on that tooth. And so you want to make sure that you have that, because Susie at the front does not know that you actually did something different. More than anybody else. So check your production on a daily basis, because that day, you'll know more that day than the day after or the day after, right? Not on a monthly basis, not on a weekly basis, on a daily basis. So adjusted production for you guys. 35% is what you can, here in New England, where you can negotiate. And
that's fair. But I know a lot of different organizations that I've seen some at 25%. I've seen 30%, 28%.
It's regional, and so we have 35%, and the question is that do the exam count, and the exam should count.
Right.
Make sure that the exam counts. So now we're getting into the nitty-gritty.
Wait, I want to just back up, because
The
I want to
exam
make sure
does count.
exam on hygiene. When you go into the hygiene
Absolutely.
room and you're examining a patient and you charge them $80 for an exam, you should get 35%.
Whatever you're charging,
whatever
whether
it
it's $800 or $80,
Yeah.
you got to get 35% of that exam and restorative dentistry.
And that's very important.
That is
to make
very
sure it goes under your production.
That's
and that's
right.
why you got to keep track of your money,
Yeah.
because who cares about
And
it?
if you like doing children dentistry and that child is not really behaving and you end up doing that in your room, you're getting also the hygiene, 35% of the hygiene sealant that you're doing, whatever it is that
And the
you're doing.
X-rays and everything else.
That's the X-rays. Not the X-ray. The X-rays most of the time is not is.
But if
goes
you
to
took
that.
the X-ray in your room,
If you took the X-ray in your room, yes,
right,
like
right.
the endodontist.
no,
those
I'm
guys.
just talking
Yeah.
hygiene, no, but
Right.
the exam.
If
yes.
you're doing a hygiene procedure in your
Okay.
room, then you'll get it.
right.
That's another question. Actually, I'm going to ask that question for him. uh, what if a DSO asks you to do cleanings? Is that
That's all I
reasonable
want
or
to do.
not?
Yeah.
Is that reasonable or not? Initially, you have to build your patient base. Ultimately, if you have enough restorative dentistry to do, you just want to do restorative dentistry. But
You want them to do more restorative dentistry, right?
right, everyone wants you to do more restorative dentistry, including yourself. But you don't have a better case to get your case acceptance approved or ratified by the patient than when you do the cleaning, because during the cleaning, you're spending 20, 30 minutes with that patient.
Building the trust.
Building the trust, you're building that rapport, and so that to me is a no-brainer. And I cringe when I sometimes see dentists that say, "Oh, I only want to do restorative dentistry. I don't want to do cleaning." Well, initially, if you want to build your patient pool, why not? That's going to help build your patient pool. Ultimately, you'll have one column of restorative dentistry, one column if you're very productive, one column of deliveries or quick check.
Mhm.
That's when you deliver and you do your quick check, and you're doing your hygiene checks, and one column that you share, with another colleague doing the emergencies. This is one of the key things. So one column for restorative dentistry, as you get proficient, as you get the speed, but one column for restorative dentistry, another column for your deliveries.
So you talk about speed. I just want to
But that's
no. I
yeah.
want to talk about this for a second
Yeah.
because a lot of people, some people take an hour for a crown. Other people might need 2 hours for a crown. So the front desk is going to be working with you to understand it, because you don't want to keep patients waiting, right?
That's right. We don't want to keep patients waiting, and so the column I was just describing is on your way to become more productive as you're gaining speed. Because otherwise, if it'd be great if we had a compensation model based on satisfaction survey. Wouldn't that be great?
That'd be
right?
great, yeah.
You get 25% if you only did 3-star, but at 4-star you get 32%. 5 stars you get 35%.
That'd be great.
Something that we're thinking about, but. Dr. Perry is right. You got to develop your speed with time, and this is typically
But that's speed, but not sacrificing quality.
not sacrifice quality and patient service.
Exactly.
The quality.
They want to
patient
feel like
experience.
you've spent the time, the
That's
right
right.
time with
That's
them.
right. And if you're taking 2 hours to do a crown, that's where the clinical development, because if no one's going to show you how to be able to prep a crown, whether you're using a functional cusp or non-functional cusp, it does not matter. You have to join a group where you will be able to prep a crown and temp it, within 45 minutes. You know
Right.
what I mean?
Right.
And your assistant's going to do a lot of the temping
Right.
that's allowed.
And being
so-
able, and this is, you also help them train how to utilize an assistant correctly.
Yeah.
A lot of them in dental school haven't used assistants, or
Yeah.
very minimal on that.
So
Just-
our chief clinical officer is implementing a course on a crown prep efficiency.
oh, good.
Right?
That's good.
And how to scan
Everything,
it.
tissue management, and everything, and all that.
Everything with
Okay.
it.
Couple more questions that I
Sure.
really want to. One is going to be about, what do you see as the most common mistakes that young dentists, when they are evaluating a job? What are some of the, job offers? Like anything from choosing salary over mentorship, or ignoring contract details, or maybe overestimating productivity, or what do you see the biggest problems that young dentists face when they're looking at job pursuit?
Great question. I think that they're not looking. They don't interview the employer as much as the employer is interviewing them. So remember, you want to go there. You want to visit the site. You want to talk to the doctors, talk to the staff. Why would you go and work in this organization? Life is very short and precious. You want to be picky at choosing the employee you're going to be working with, right? And so sometimes I feel that they look at what I call, the numbers and the paper, the dry numbers, and they don't necessarily value the relationship or look into the relationship. So I would recommend you spend a little bit more time interviewing that employer, asking questions, visiting their site, talking to their staff, talking to their doctors, and getting a feel for that, because ultimately
It's like a marriage in some
it
respects.
is, yeah, it is. It's by the time you really realize what's going on, it's going to take like 6 months or 8 months, and why not do a little bit more work at the beginning, invest into that discovery, that due diligence, right? Think about it. You got to do your own due diligence, and it's not only paper, right? It's dentistry is relationship, and you know what? And that example that you cited, Dr. Perry, which is I grad middle of my class. I may not necessarily be the fastest or the best clinically, but it's your personality, because we can teach you that. And when I say we, like any employer, any group can teach you, can invest in your clinical development, in your quality and speed and all that. But one thing that we cannot change is your personality. So you will see that your classmates that have the best personalities are outgoing, easy to work with, they don't make a big deal out of nothing, will end up being the most successful in life. And it's not about that millimeter or half a millimeter, or it's about the global thing, right? Personality. And I think that 80% of our game is personality, because the skill could be developed, could be taught, but personality, you can work on it, right?
Everybody has their own style.
Everyone has their own style.
Exactly.
And so work on developing that aspect.
Patrick, I wish I could keep you all day, honestly, because you have so much information, you have so much to share with the group, and I have a ton of questions. I know my audience will have a ton of questions, but let me close with this, okay? I want you to give the audience 3 pieces of advice that you would say to a new graduate coming out that they should do while they're looking for a job and they're making that transition into becoming a dentist. What's the 3 pieces of advice that you would give them that really the take home for them?
Fantastic question. The first thing I'd say is that if you're thinking of specializing, right, go for it. Do not have any regret. Like, if you have a passion for something, go for it. Dentistry has, in the last decade, became very, very, very interesting. It has evolved a lot, right, with the dental material and the digital flow and all that. But that being said, if you feel you want to specialize, go for it. Okay, we don't want you regretting that. That's one thing.
So if you want to be a pediatric periodontist, a prosthodontist, ortho, whatever,
go for it. Get it out of your chest here. Go for it. Do it. And I'm behind you. I support you. The second thing is choose where you want to live. Okay, when deciding where, because sometimes you may be attracted by going where it's a little bit easier. Across the nation, there is disproportion in terms of the pocket where there are needs. You can go somewhere where the need is greater, but that may not be where you want to live. So you may initially be happy because you're making a little bit more money,
right?
But after 3 to 5 years, you will end up being like succeeding no matter what, wherever you are, and you'd be the best version of yourself. So don't get trapped into going somewhere where you don't want to be, right?
Can I just add to that though?
Sure.
Just not only where you want to be, but make sure that whoever's in your life, make sure that they want to be in the same place.
That's right. And you could typically, as long as you could work within 45-minute drive, that's fine. So wherever you want to go, you can still drive within 45 minutes. That's a coffee, one phone call, and there's a little bit of time. That's the time I used to meditate. I don't do yoga, maybe I should, but that's the time that I would have a coffee and I would just drive, call my mother, and within, by the time you know it, 45 minutes has passed.
And what's the last piece of advice you give?
And the last piece of advice is look at the clinical culture. Look at that employer that's going to invest in you, right? That's gonna help you get that clinical development.
And you're happy to go to work every day, right?
And you're happy to go to work, and not necessarily only at the compensation. Compensation could be great, don't get me wrong. But the key is that what's going to be the clinical development, because this is the time right now after dental school, where your mind is the most plastic, where you can still incorporate and learn. You're still, you're an adult, but technically speaking, your dental brain is a sponge still, and so take advantage of that. Now is the time to embrace it with more knowledge, to get with more courses, with more this. And in 15 years, it's not going to be the same. You're still going to be able to learn a few tricks, but now is the time to take advantage of that. Now is the time. I'm teaching my daughter how to play tennis because she's going to advance at a lot faster rate, and you will advance at a lot faster rate if you take advantage of that timing shortly after graduation. Stay hungry, stay focused, right, and go for your clinical development and the clinical culture. I would say those are the three things.
Well, Patrick, I mean, you have a tremendous amount of insight. I thank you for coming on today, and I know my audience is going to want to hear more from you. So we're going to I'm going to ask you to come back.
I'm a phone call away, that.
And I appreciate. I mean, you're helping so many dentists, and there's a lot about Patrick that the audience doesn't know, but he helps not only the dentists, young dentists, and making them successful. Because if they're successful, he's successful, and the organization's successful. So it's a win-win all the way around the group. But I want to say thank you so much for coming on.
Thank you so much.
This is Dr. Perry, and make sure you're looking out for my podcast. Make sure there's going to be more coming your way. You better be looking for them because a lot of important information that you're not going to be getting anywhere else. Anyway, have a great day. Talk to you soon.
Thank you.
Thank you.